So now I am going to talk about the ankle series. This video is going to be about the image evaluation of the ankle. Usually when a provider orders an ankle, it's usually a 3-view, which includes the AP and then the oblique, they call it the mortise view, and then the lateral. Whenever you do anything with an ankle, you want to make sure that there's basically 1 inch on the sides, and then it's basically 8 inches from the heel all the way to about 1/3 of the tibia and the fibula, which is basically like 8 inches. When you do an AP ankle, it's normally supposed to have a nice little overlap between the fibula and the tibia, and then also a little bit of the talus too. There's a little overlap right here, and that's normal. That's what you are looking for. That's what you want. And then you also just want to make sure that the joint space right here is nice and open. Even though you can't really see this area, but the joint space around here should be nice and open. For the oblique, what you want to do, the main purpose of the oblique is to open up this joint space. We call it the ankle mortise. So this right here is like the ankle mortise. And you want this to be nice and opened up. And the way that you open it up is just you make sure that you do a little bit of a medial rotation of the ankle about 15 to 20 degrees. And this is what we're looking for, a nice open space. Sometimes people have a hard time flexing, so that's okay. But the best possible is if this is nice and open. And so now I'm going to talk about the lateral ankle. For the lateral ankle, you want to collimate to include like the entire heel, which I would have like opened it up so that I could like include the entire heel, and then the base of the 5th metatarsal. So you can't really see it on here, but the 5th metatarsal should be right there. So I would have opened up a little bit more to include everything. And then you also want to make sure that this joint right here is nice and open. So the fibula needs to be in the posterior half of the tibia. But I will show you how I usually like to collimate. So none of these pictures I've actually taken, especially where I work. You're not allowed to take pictures of the x-rays that you've done. So unfortunately, all of these x-rays are x-rays that I have to get off the internet. But you can see here, this ankle is more open, so you can see more of the metatarsals and everything. So you can for sure see the base of the 5th metatarsal. And I was taught to always include the base of the 5th metatarsal because that's where, I guess they call it a Jones fracture. Whenever you have a fracture of the base of the 5th metatarsal, those are really common for ankle injuries. So it's really important to include that. Thank you so much for watching.